Okay, for my autoimmune disorder, I chose to do Sjogren's syndrome. Um, I have a particular interest in this because I was diagnosed with Sjogren's syndrome as a secondary to systemic lupus 15 years ago. So I kind of have quite a bit of knowledge about it. First off, Sjogren's syndrome is a systemic autoimmune disease. It affects a whole lot of different systems in your body or places in your body. The main characteristics of it is dry eye and dry mouth because your immune system attacks your tear ducts and your salivatory glands. But it can also affect your joints, like the fluid in your joints. If you basically think like fluid in your digestive system, anywhere you have fluid or any type of lubrication in your body, Sjogren's syndrome can influence that. So it can cause constipation or joint immobility due to dryness. So you have crepitus in your joints due to lack of fluid and stuff like that. Um, let's see. It, like I said, it attacks the tear ducts and the salivatory glands. Your prognosis with this, like how they diagnosed it with me, they did an ANA lab, which is a anti-nuclear antibody test, along with signs and symptoms. I My eyes were constantly dry, chronic constipation and stuff like that. So it's not just like a diagnostic test that they're going to run. They're also going to do a lot of questions and answer type of to diagnose Sjogren's syndrome due to your signs and symptoms and things like that. As far as treatment goes, you're basically just looking at treating your signs and symptoms, like drinking lots and lots of extra fluid during the day to combat the intestinal dryness. There is re-wetting drops for your eyes that you can use. They make a special mouth rinse that, like a Biotine mouth rinse, that helps keep the salivatory glands producing, so that way your mouth can stay lubricated. You need to see a dentist a lot more often than you thought you needed to, because the dryness affects like your dental cavities and like the outside coating of your teeth and stuff like that. You're at a higher risk for dental problems all around. Statistics for the affected, you're looking at mostly women, usually starting around the age of 40. I, however, was diagnosed shortly before I turned 25 with this. It's linked a lot of times to rheumatoid arthritis, or, like I said, systemic lupus. It's usually a secondary diagnosis that you're going to get. There's more than 1 million people in the United States have been diagnosed with Sjogren's syndrome. So it is approximately right now affecting just as many people as breast cancer is affecting. It's relatively along the same lines as the number of people. So that's basically all the information I can give you about Sjogren's syndrome. Um, if you have any questions, please write in the comments. Ask me whatever you'd like. I'm more than happy to answer anything. Thanks.